Good morning. I'm Jim Cucinato from Hale Health, and I am the Radio Vision medical expert. Today, I'm very excited because we have Mr. Peter Allen, who is a sleep expert, joining us today. Peter is very interesting. He has literally lectured all over the world talking about the dangers of sleep disorders and, of course, how to fix them. The first question that I have for Peter is, I noticed that your parents gifted you with a really short name because you have like 1,000 letters after it. Can you explain some of your credentials to us?
Well, thanks for having me, Jim. I appreciate it. All the credentials, the world of sleep disorder medicine encompasses from head to toes.
Okay.
So my background is part critical care respiratory therapy, and then also boarded in sleep disorder medicine as a technologist.
Okay.
So there's so many different associations and warring factions and whatnot involved in credentialing that we just try to get as many credentials as we can, so we never get locked out of any party in the world of sleep disorder medicine.
Okay, so and a credential is kind of an entrance to a type of sleep theory or sleep.
Well, as a therapist or as a technician, you have to get some type of board review.
Okay.
Or stamp of approval.
Great.
As such. And we're out there as physician extenders working in the hospitals and the sleep labs throughout the area. So many people involved in sleep as extenders to the physicians have both respiratory and as far as sleep credentials, more so that just tie them in with all sides politically.
Okay.
Yeah.
And you mentioned off the air that you're a director. You're on the board of directors of a couple of societies, and you have a very interesting role in those societies.
Well, just recently I got elected to the American Academy of Sleep Technologists, which is a nationwide board. All of your sleep technologists working at sleep labs throughout the country belong to it. And my role on the board, as I've just discovered, happily, is going to be contacting all the state sleep societies to work with them as technology evolves. People's jobs evolve.
Right.
So that'll be a big part of what I'll be doing.
So you're kind of a sleep reform, so to speak.
Well, yeah, I don't know how much reform or just better outcomes for patients and changes like anyone would have in a work environment that are technology driven.
Right.
That's the challenges in sleep disorder medicine today, which in the end benefit the patient.
Okay. Excellent. One of the things that we wanted to talk about in sleep is sleep. I thought if you're an expert in sleep, we were looking at it and we said, how many hours of sleep should a normal person get? Is there is it a min-max? Is it a range? Is it a hard and fast 7 hours or 8 hours?
Well, in a nutshell, of course, it's a large area here. We're talking pediatrics, adolescents, adults. With the peds, obviously, they need a lot of sleep. Babies sleep almost all the time. You're getting into teenage years. Teenagers need 9 to 11 hours of sleep a night. And
okay.
School schedules are a big topic of discussion there as far as how early they're getting them in the mornings. Then your average adult, 6 to 7 hours a night seems to be the basic amount of sleep
that they require.
Yeah. Mm-hmm.
Good. So that's excellent. I can tell you I am a 6-hour to the minute person, which is good and bad. Because,
well, you're blessed.
Yeah. I go to bed at 10:30, which you could do the math, which means I'm out of the house every day at 5 o'clock. My wife, on the other hand, is maybe 6 hours spread over 12 hours. She's not blessed with that sound sleep. How does the amount of time that you're, quote, sound asleep affect you?
Well, it's amount of time and it's quality of sleep. You have two different things there. So you have your general time requirements that are just general guidelines by the American Academy of Sleep Medicine, and then it's the quality of sleep.
Right.
Do you wake up a lot? Are there things that go bump in the night? Are you somebody that gets up and walks around the house at night? Is sleep apnea involved?
Right.
Are you someone who snores and the snoring wakes you up and also wears you out as you
right.
sleep? So it's really quality of sleep is what we're focused on.
Right, and that's, if you said from a very high level, your job is to analyze the quality of sleep and to figure out if you're not getting the correct quality of sleep, how to fix that, correct?
Well, Yes, a patient goes to their physician. They're having a problem with their sleep. They're not quite sure what it is. Physician refers them into a sleep disorder center.
Okay.
They meet with a boarded sleep physician,
Mm-hmm.
who then looks at their whole medical history and then takes a look at things focused in on sleep.
Right.
How much they sleep, what's their schedule like, what's their routine like, when do they eat, when do they drink things like coffee, caffeine, it's in tea and so many foods. And it all rolls up into a package of diagnostics and then treatment options.
Great. I'm Jim Cucinato. I'm here with Peter Allen, our sleep expert for today. And one of the questions that I always have about it is, what question should I ask my doctor? When I go on my annual physical, and if the doctor doesn't say, how do you sleep, is that a question that I should bring up and say, hey, doc, I have problems sleeping?
Well, Jim, that's a good question, but it's even beyond that now, because most family practitioners, they've all got on their list of questions, list of things to go over with patients, at least one or two sleep questions.
Okay.
You've got a lot of people with insomnia out there, and then you have a lot of people with sleep apnea in the adult population.
Right.
So the family practitioners tease these things out during their list of top 10 questions they may be asking during an annual physical, or they may sense that the patient has a problem with daytime energy.
Okay.
The spouse is complaining, he or she snores.
Right.
We can't sleep because they're snoring. And most family practitioners nowadays know exactly what to do with that information, as opposed to just 25, 30 years ago.
Okay. And so we talked about a bunch of different things about kind of sleep issues or signs you may be having bad sleep. So if you snore, or if your partner snores, right, would be signs of there's a sleep disorder in the house. If you're a night walker.
And Jim, there's about 120 different sleep disorders.
Okay.
But the one that we see most predominantly in sleep labs is obstructive sleep apnea.
Okay.
So that's 95% of the people who come into a sleep lab. So the doctor senses that there's daytime drowsiness involved with the patient, even though they're sleeping all night. They wake up in the morning, they feel like they've been run over by a truck, and on top of that, the spouse tells them that they're snoring all night.
Right. Okay. And it's not. It's different than chronic fatigue, obviously. If you're not sleeping properly and you have apnea, you're not getting the rest and able to recharge, and you end up with, a long day, so to speak.
Well, it can contribute to chronic fatigue, and sleep apnea is the great aggravator.
Okay.
Anything else you've got going on, any other medical situation, it's probably going to aggravate it. It's going to make it worse.
Great. We are talking to Peter Allen, a sleep expert. We just learned a little bit about sleep and kind of the studies and the different types of disorders. When we come back, we're going to dive into sleep apnea, because that is a huge topic in sleep that we need to explore. I'm Jim Cucinato, and this is Radio Vision.
If you haven't been to Speed Raceway, what are you waiting for? You want to live fast? You want to make every second count? Then grab the family. Round up the guys. Speed Raceway is 100,000 square feet of excitement, whether you're a kid or a kid at heart. Speed Raceway is the place for endless fun all summer long. Log on to speedraceway.com or just get here now.
Okay, welcome back to Morning Coffee. I'm Jim Cucinato from Halo Health. I'm here today with Peter Allen. He is our sleep expert. We are talking about sleep and how it affects your life. And one of the things that is a huge topic in sleep right now is obstructive sleep disorder, sleep apnea. Peter is an expert in this. This is one of the things that he lectures all over the world about. So let's start with the simplest thing. What is sleep apnea?
Well, speaking as a technician, a technologist, respiratory therapist, obstructive sleep apnea, which most notably people find out about because someone says, you're snoring.
Okay.
And there's noise. There's work of breathing that's beyond just easy sleeping and breathing. The upper airway starts to collapse on itself as a person's breathing. They're still trying to breathe, but the upper airway closes off, airflow closes, and it's just like being in a swimming pool. They go to the bottom of the pool, and suddenly they need oxygen again, and boom, They get woken up.
Woken up,
The brain
okay.
wakes them up to take a breath. So that disrupts their sleep through the night. And what we do is get them in for diagnostic studies, either in the home or in a sleep lab, and
Right.
see whether mild, moderate, or severe.
Okay. Is there a snore pattern that the spouse should be listening for? Is it something where if they snore like a buzzsaw, they're clogged? But
There's a
if
lot
it's-
of different ways to describe snoring, walls being blown out, that type of thing, and there's
Right.
no specific snore pattern or sound. People will tell you they know it when they hear it.
Okay.
If it walks like a duck, looks like a duck, it's a duck. It's sleep apnea. It's
Okay.
snoring. And then what we do is determine mild, moderate, severe, and the boarded sleep physician, who they should be visiting, their family doctor should refer them
Right.
to a sleep doctor, then gives them different treatment pathways depending on their level of severity.
Okay. And what are the different treatments?
Well, with someone who has mild sleep apnea, where they're just making some noise and it's not really causing them to be tired the next day, they don't have any other symptoms such as it's not aggravating high blood pressure or diabetes or anything like that. Sometimes it could be positional. They snore more on their back than on their side. So keep them on their side while they're sleeping.
Right.
It could be dental devices that just move the jaw forward a little bit. That's the mild group. Once you get into mainstream obstructive sleep apnea, the cure is positive air pressure
Okay.
devices, which through the years have improved greatly. So it's an immediate effect that they have with the patient.
Okay. And this device, is it something that bolts onto the bed? How does that kind of work?
Yeah, basically a little box sits by the bed. It's not too noisy. They used to be pretty noisy. And you've got tubing that runs to a mask that the patient has picked out, a comfy mask that goes over the nose. And basically, it just keeps the airway open. The patient's breathing. It's not a ventilator. And
Right.
it's just room air. And they breathe. They trigger the little bit of added pressure. It just keeps their airway open. So in the morning, they wake up and they feel like they actually slept instead of struggling to breathe all night.
Okay. And is that better for a side sleeper or a back sleeper?
Well, positionally, that's the mild side, where you might say somebody's worse on their back than on their side.
But when they're wearing the apparatus, does that
The
mean-
mask doesn't matter what side
Side
they
you are.
oh, good point. They
Yeah.
can sleep any way they want. If there's a bed partner, they're right in there, and it works out much easier than you would think it would
It would,
in a
okay.
bedroom. Yes.
And then I've been told that people sleep or snore more maybe when they've consumed alcohol or if they're a little overweight. Are there different things that they could do from a dietary or a exercise and lifestyle to reduce the amount of snoring and help, with the
Well,
sleep apnea?
there's a lot of factors that go into obstructive sleep apnea. Weight is one of them. Alcohol consumption before bed will actually make it worse.
Okay.
Anything that relaxes the upper airway. Anesthesia. Someone's going in for surgery. They definitely should be screened for sleep apnea.
Okay.
It's not so much going under anesthesia, it's coming back out again, because anything like alcohol or anesthesia is going to keep the upper airway much more prone to collapsing.
Okay.
And it's harder for them to recover from anesthesia, for instance. So whether it's alcohol or some other type of a medication, it can affect the upper airway, and their doctor can give them details on what to avoid and how to work that into their lifestyle.
Great. One of the things that we were talking about was cardiovascular health, right? And how sleep and cardiovascular health are really linked together. Obviously, if you have sleep apnea, you're having problems breathing while you're sleeping. Is that putting a lot of extra stress on your heart?
Yeah, if you can just imagine holding your breath every 10 or 20 seconds and then forcing a breath.
Mm-hmm.
Your heart rate goes up, your blood pressure goes up, the parts of your heart, left side of your heart, actually starts to get a workout that it should not be getting.
Okay.
So cardiologists are definitely screening all their patients for any level of sleep apnea. Again, because obstructive sleep apnea can either be a factor towards or increase a patient's propensity to having high blood pressure.
Okay.
And also type 2 diabetes, there's a direct tie-in
Right.
there also with
So
obstructive sleep
family
apnea
history
patients.
of high diabetes, high blood pressure, maybe with people with family history of heart condition. These are people that should be looking as early as they can then, right, talking to their doctors about
Right,
this.
and what the family practitioners do nowadays, which it was, again, sleep disorder medicine's only been around for 40, 45 years or so. So now they're learning to look at all the risk factors
Right.
that tie in and decide this person should at least get screened, a rule in, rule out type sleep study, whether, again, it's in the home or it's in a sleep lab, that to be decided by the patient and the sleep disorder physician
Right.
that they're referred to. But there's many different factors, as you mentioned. Many of them are genetic in nature.
Okay. You just mentioned something that was going to be one of my next questions. You're talking about the sleep study. So I could do it at home, or I could go to a sleep center.
For obstructive sleep apnea only.
Right.
If there's anything else that's a concern, anything that's complicated about a patient from a healthcare perspective, the best thing is to get into a hospital sleep lab and have a full sleep study done. That again can be determined by your sleep expert physician
Right.
during the time of the consult with the patient, whether a home study would be appropriate or we really need to get you in for a full lab study.
And what does a full lab study entail?
Well, it's a little bit of everything, and that's why all the credentials and training behind my name and my background. It's EEG. Nothing hurts. Everything's non-invasive. There's no pain in sleep disorder medicine, which is a nice thing. So that's just keep that in mind. It's easy. You get you can ask your physician, your technician ahead of time to get a feel for what's involved. But it's overnight, and some people find it's a nice break to get away.
Right. So kind of like a vacation or a staycation. You could
Yes,
do.
exactly.
Go away for an overnight, but you really didn't go anywhere.
Right.
Awesome. I'm here with Peter Allen. He's our resident health expert today on sleep. We are talking about sleep apnea and all of the different types of treatments and how sleep apnea affects your health. When we come back from this break, we will talk to Peter about what you can do to make sure that you are sleeping properly.
Simply Gents, located in Marlton, New Jersey, takes care of all your grooming needs, including haircuts, straight razor shaves, massages, facial, manicures, pedicures, and waxing. To find more information or book an appointment, visit us online at www.simplygents.com. The secret weapon of a well-groomed man, Simply Gents.
Saving your business money is as easy as 1, 2, 3. Tanker Consulting Services, a payment solutions expert, will show you how with a free, detailed, written analysis illustrating your cost savings. We usually uncover savings between 10 and 25%, and sometimes more. We can help your business succeed by providing reliable and secure merchant payment solutions such as merchant services programs, point-of-sale systems, and ATM machines. TCS, one of the leaders in regional credit card processing consulting, offers electronic payments to merchants locally and nationwide through our preferred vendor programs. We work to keep business costs down with a comprehensive suite of quality products, services, and customized credit card processing programs exclusively tailored for your company. TCS is convenient, reliable, and innovative, with customer service available 24/7, 365 days a year. Our in-depth industry knowledge, partnership strategy, and innovative processing solutions allow for a specialized approach to providing merchant bank processing with 100% full fee disclosure. TCS is one-stop shopping for all your merchant services solutions. Our clients save money 100% of the time. Trust Tanker Consulting Services, the knowledgeable, professional, and friendly provider of secure payment services. We set the standard by which others are measured. Call now for a free written analysis. 609-922-0201.
When it's time for Jersey Mike's to give a sub some sizzle, this is the way. The way it's always been. The way it always should be. The way it always will be. Because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
If you haven't been to Speed Raceway, what are you waiting for? You want to live fast? You want to make every second count? Then grab the family. Round up the guys. Speed Raceway is 100,000 square feet of excitement, whether you're a kid or a kid at heart. Speed Raceway is the place for endless fun all summer long. Log on to speedraceway.com or just get here now.
Today's show has been sponsored by More Than Gifts. Come see our new location in Marlton, New Jersey. Not just gifts, but more.
I'm Jim Cucinato on Morning Coffee. I'm here with Peter Allen, a sleep expert, and we were talking about sleep studies. One of the things that we talked about in the first segment was we talked about what is sleep, the proper amount of sleep. Then we were talking about sleep apnea and kind of the different types of treatments and diagnosis. Now we're talking specifically about sleep studies, and we said you can either do it at home or you could do it in a sleep center. We said that sleep center is kind of like a staycation.
In a way, and the thing with sleep disorder labs nowadays is it's like coming to a hotel. It's very comfy. And you bring whatever makes you comfortable, your favorite pillow, quilt, family member, whatever it may be. We've had care dogs and everything else in the lab. I do draw the line at farm animals, no chickens, goats, sheep.
Right.
But
Well, you don't want to wake up everybody else.
Yeah, we don't want roosters going off at 3 in the morning. But,
Right.
but basically, Jim, what happens is people come in, they get comfy, everything goes on that needs to go on sensor-wise. It's all just tape and sticky type things. Nothing hurts. And they watch TV on their flat screen TV. They got their own bathroom and shower. And come the morning, we have an idea of where they're at.
Right.
And then they get back with the sleep disorder physician and decide on what kind of a treatment pathway, if any, is needed.
Do you find that people who are under a sleep study tend to sleep better or worse than they normally do at home?
They actually, their perception may be different as to how they slept.
Right.
They may feel like they were isolated and it was great and they had a break from just being in their normal environment. But the clinical information that we get during the study is really about the same as if they were at home.
At home.
Yeah.
You kind of take away some of the environmental factors, though, as well.
Right.
They're not drinking alcohol right before they fall asleep.
Hopefully not, or
right.
we know about it. And then the tech has to make a decision there as to how many drinks they had and whether we're going to continue.
Get a good study
They
out of
get
it.
certain guidelines before they come in for the study.
Okay.
And basically, it's have a normal day. Come in, and the techs tell bad jokes. You get bored, you fall asleep.
Oh, perfect.
That's it.
Sure, that's awesome. And then when they wake up in the morning, is it the type of thing where there's an immediate response? Do you have your sleep study at that night, and at 9 o'clock the next morning you meet with your physician, or does it typically take a couple weeks for a result?
Different labs work different turnovers. Their flow is different. So as a patient, you may have your sleep study. It gets read. It gets scored. It takes about a week.
Okay.
And then they have an appointment to follow up with the sleep physician to see where they want to go from there. So the big thing is that they start with a sleep disorder physician and have their studies, follow up with a sleep disorder physician, have any studies that they may need, treatment type studies after that, and have that constant education and involvement by the medical professional all along the way.
And then obviously when the diagnosis comes back, there's a lot of apparatus if you have severe or moderate or severe sleep apnea. How does the training work? Is it something?
As we discussed earlier, positive air pressure, known as CPAP, continuous positive air pressure. Basically it's about an hour and a half for a patient to get trained on how to use the equipment. It's pushing a button, putting a mask on, and feeling yourself go to sleep without coughing and gagging.
Nice.
For the first time in maybe 25, 30 years.
Right.
So the very next day even, after a patient has been on that therapy, which is room air, it's their own rate, however they want to breathe, just a little extra air pressure, it makes a huge difference almost immediately for them.
So they're immediately feeling better. They've got more energy typically.
Right.
I don't know if they look better. That'd be
Yeah,
the eyes would
yes,
be older.
Jim, definitely. But really, the thing is, instead of waking up after 8 hours of sleeping and feeling like they've been hit by a brick wall or a truck or whatever, they're waking up and they feel rested.
Right.
And it's a very immediate thing. It's not something you have to, in other types of medicine, you have to wait for a while to see something.
Right.
This is immediate. And then you have all the follow-up with the physician
Right.
to make sure that they're in compliance and it's working out. And a patient who is treated properly for a sleep disorder, they will feel the difference very quickly.
Okay.
No matter what type of a sleep disorder it is. It won't take months
Right.
or years.
And will you also see almost immediate drops in blood pressure, the diabetes being more manageable? Do you see, the ancillary diseases that kind of are
Well,
going hand in
yeah,
hand
all the things
through?
that sleep apnea aggravates, it's not a cure for all those
Right.
items, but all the arrows start going in better directions usually once they are treated.
Excellent. And is it a lifetime thing? So once you start with, say, a CPAP machine, do you use that for the rest of your life typically?
Pretty much, and that's a typical question that a patient will ask. The upside is that once a patient gets through one night, the more severe the patient was, the greater the treatment is, the more profound the effect. So once a patient gets treated for even a few nights,
Right.
you can't get that CPAP machine
Just
away
becomes
from
part of
them.
their
They
routine.
with no problem, boom, it's part of what they do and who they are.
Excellent. I'm Jim Cucinato. I'm here with Peter Allen. We were talking about sleep on Radio Vision's Morning Coffee. One of the traditions we have, Peter, is that the last part of the last segment of our half hour, which really flew by, is that you get to look into the camera here and you get to tell everybody what they need to know about why they should care about Peter Allen and sleep.
Well, I don't know about the Peter Allen part, Jim, but sleep disorder medicine, if you suffer from insomnia, have a disorder where you move around at night, where you end up on the front lawn, you're not sure how you got there, and especially if someone has told you that you snore, you need to bring that up with your family physician and get in to see a sleep disorder professional to have that diagnosed and possibly treated and change your life. Get rid of the snoring, get some rest. That's what it comes down to.
Awesome. Thank you. I'm Jim Cucinato, medical expert, put expert in quotes, for Radio Vision and Morning Coffee. I was here today with Peter Allen. We will see you next week. Everybody enjoy the 4th.
Thanks, Jim.
Thank you.